Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department to give our weekly update on COVID-19. It has now been, we're coming upon the 1-year anniversary of when we had that very famous, I guess, Thursday press conference at the Emergency Operations Center with Dr. Bogan, who had just begun her tenure at the Allegheny County Health Department, and some of our medical experts from UPMC and AHN. And then the infamous Sunday night in the park press conference, Facebook Live, etc., that we had, basically shutting things down as the coronavirus started to come into our community. And it's been a year of certainly challenge. The good news, I think, as we approach the 1-year anniversary is the vaccines that are now being distributed throughout our community. We've had almost 100,000 of our fellow Allegheny County residents who have been fully vaccinated, and roughly another 150,000 folks who have at least had their first shot. And that will continue to ramp up, again, with all of the partners that we have out in the community, our hospitals, our pharmacies, the health department, which gets about 10% of the vaccines that are distributed throughout this county to fill in the gaps and do the things that we need to do. The good news over the last couple of weeks is while the numbers have come down from about 3 weeks from before for the last 3 weeks, we've kind of plateaued. They've ticked up a little bit, ticked down a little bit. They're still higher than we certainly would like to see them, in the 200 range, 180 to 240, somewhere in that range on a daily basis. We want to continue to see the mask wearing and the social distancing that we know we need to do for the last, hopefully the last couple of months, until we get to a point where most of our residents and most of our citizens are vaccinated. So let's continue to follow the great advice that our medical experts are giving us, and continue to be vigilant and get those vaccines when you can. The signups that are out there and all the places to do that. So let me turn it over to Dr. Bogan to give her weekly update. Dr. Bogan.
Good afternoon, and thank you for joining us again today. Our case counts in Allegheny County remain stable. This week, our 7-day rolling positivity rate is 5.2%, a small decrease from last week's 5.9%. Similarly, the 7-day rolling daily case count is about 160 a day, a small decrease from last week's 170. Hospitalizations and deaths continue to decline slowly. Until vaccination rates increase, we must continue to rely on the 3 pillars of pandemic control: case identification through testing, case investigation, and contact tracing. And the health department continues to pursue these strategies as we increase our vaccination efforts. Despite stable case numbers, testing remains quite low, on average about 4,000 tests a day. So I want to remind people to please get tested if you have any symptoms or if you are a close contact of a case. Our investigation team continues to reach out to nearly every case reported to us. Among the nearly 1,600 new cases last week, our team made contact with 60% of those, and about 90% of those were reached within 24 hours and 100% within 72 hours. Cases reported traveling across the US, attending schools from preschool to college, as well as traveling to workplaces, childcare centers, restaurants, bars, and attending parties, celebrations, and get-togethers. In fact, in the first 7 days of March, the number of cases reporting attending parties or events is more than double what was reported in the entire month of February. Our contact tracers continue their work as well, and although the number of contacts provided by cases has been relatively low, we are reaching more than 80% of the contacts. So just like the health department continues boots on the ground work to contain the virus, we ask that you continue to do your part. With this lovely spring-like weather, like you, I am ready to get out and be together with friends and family, particularly miss my siblings and my nieces. However, some of my family members are really high risk for adverse health outcomes from COVID-19, so I remain very cautious until we are all vaccinated. And I ask that you do the same. limit your gatherings to small numbers, and wear your masks just a little bit longer. On to vaccines. Over the last couple of weeks, we have seen a stabilization of the vaccine supply from the Commonwealth. While the quantities of vaccine we're receiving fall short of the demand, communication and actual delivery of the vaccine from the Pennsylvania Department of Health is improving. And we know they're working diligently to resolve some lingering challenges and appreciate all they have done to improve the process. As of today, our health department has administered over 53,000 vaccines. Our Castle Shannon site this week again provided the Pfizer vaccine, and it's reached its goal of providing about 1,000 vaccines each day. This week, our Monroeville site has been providing second doses of Moderna vaccine at approximately the same rate. And we are close to announcing an opening of another site, which I will provide details when that's ready. And we continue to provide vaccinations in our senior living facilities. And this week, we're visiting our second largest municipality, Penn Hills. As some of you may know, early on, we worked with community groups in the Hill District and Homewood and the University of Pittsburgh to provide vaccine in these communities. Over the course of the next week, this week and next, these organizations will be providing second dose vaccines. Our health department continues to focus our vaccination efforts on those 65 and older because we know that they are the most at risk for adverse outcomes with COVID-19. I continue to monitor the data, and when we're able to reach more and more of that population, that high-risk population, we will lower our age requirements for those who meet 1A conditions, but I'm letting the data really drive the timing of that change. As a reminder, the health department is just one of many people receiving and providing vaccines in the county. Currently, the health department receives about 10% of the supply of vaccine that's coming into Allegheny County. I want to just take a moment to talk about the CDC guidance that was issued this week for those who have been vaccinated. And I just wanted to go through the highlights of that guidance from the CDC. First, the CDC defines a person as fully vaccinated as those who've been fully vaccinated 2 weeks after having received either both doses of Moderna or Pfizer, or 2 weeks after receiving a single dose of the Johnson & Johnson. So when you've met those criteria, then the CDC says a fully vaccinated person can visit with other fully vaccinated people indoors without wearing a mask or without staying apart. You can visit low-risk unvaccinated people from a single household indoors without wearing a mask or staying apart. If you've been fully vaccinated, you do not need to quarantine or get tested after being exposed to a case, as long as you remain without symptoms. They also go on to say that a fully vaccinated person should continue to take precautions in public, like wearing a mask that's well fitted and keeping your physical distance. To wear masks, practice physical distancing, and adhere to other prevention measures when visiting with unvaccinated people. Avoid medium and large-sized in-person gatherings. Get tested if you have symptoms of COVID-19, and follow guidance issued by individual employers, the CDC, and the health department. So as we enter this new stage of our fight against COVID-19, when more and more people are vaccinated, we must continue thinking not only of our own health and safety, but all of those around us. So taking these simple precautions after being fully vaccinated will help us pull through this together. So please remember, we only reach about 60% of those who are cases because many people don't answer the phone. So I ask you, if you get a call from our case investigators or our contact tracers, please pick up the phone. This is really the best way for all of us to understand the spread of the virus, how prevalent it is in our community, and really understand where we're going. So thank you for answering the calls. So those are my comments for today. Thank you all. Stay safe and please remember to be kind.
The first question that we have is from Pittsburgh Business Times. Cases have started to go up, as you mentioned last week. Is there one or two types of transmission that have been driving this?
Like I said in my comments already, really our case investigation shows that there isn't one source, that it's people just out and about doing their business, going to school, going to work, going to restaurants, going to bars. It's not any one source. So I don't have any particular guidance. It's just to say we all need to continue to follow the recommendations while we're out and about.
This next question is from WTAE. With vaccines going up, number of vaccinations going up, and new cases leveling off, how concerned are you that there will be another surge?
I know people think that the health department is full of gloom and doom, but we always plan for the worst and hope for the best. So I will say that I do, of course, worry that there may be another surge coming, again, based on the case investigations and the fact that we've seen a plateauing of our cases. But if that doesn't happen, that would be just fine with me and would be fantastic.
This next question is also from WTAE. Is there one demographic at higher risk of spreading COVID-19 in March compared with the past year?
We really don't have data to support that, and so I can't provide an answer specific about that.
This next question is from Print. Can you tell us how concerned you are about the variants for vaccinated people or unvaccinated?
We know that the variants spread more efficiently, and we have had some of our outbreaks that have been associated with the variants, and again, that is one of the reasons I'm concerned that we could see a surge again is because of the variants. So I do remain cautious and following that closely.
This next question is from the Pittsburgh Business Times. What is your reaction to the short supply of vaccine to some hospitals, including St. Clair, which hasn't received vaccine supply in 3 weeks? Is there anything the county can do to alleviate that situation?
I think I've mentioned this before, but unfortunately, the county health department has no input into where the vaccines are going in the county. That decision is coming from the Pennsylvania Department of Health.
This next question is from WTAE. When can we expect phase 1B and 1C to get the green light for vaccines in Allegheny County?
I'm going to get out my crystal ball right now and not answer that question.
This question is also from WTAE. Have there been any problems with residents who get the first shot of Pfizer or Moderna's vaccine and have not been able to get their second shot within the recommended window of time?
So I can report on what we do in the health department. We have been able to meet the second dose vaccine needs of all of the people we vaccinated within the 42 days. I also want to be clear. I think there's some misconception that if you don't get it by 42 days, you can't get it. That's actually not true. You can get it beyond 42 days. The recommendations are to do it within that time because that's how it was studied. But like all vaccines, you can get the next vaccine whenever it's available. So nothing happens if you don't get it within the 42-day window, and you don't need to repeat and start all over again. You just get the second dose whenever you get it. So the ideal time is during those windows and up to 42 days, but it's absolutely fine. If something happens and you can't get it at 42 days and you get it later, it's okay.
This final question is for both of you from the Tribune Review. Does the county have any specific plans to discourage large gatherings over St. Patrick's Day weekend? And do you have any message or advice for people who are hoping to celebrate this year?
I'll give the advice and leave the first part of the question for our county executive. We know that this virus spreads very efficiently when you take your masks off, you get close to people, you shout, you yell, you sing. The more you increase the amplitude of your voice and the closer you are to people, the more efficient that those particles spread from your breath onto other people. And that particularly is efficient indoors. So my recommendation is if you are going to have a St. Patty's Day celebration, keep it small, preferably if you're going to be outdoors if you can, and as much as you can, stay physically distanced. And of course, always for your health, I don't recommend excessive drinking, says the health director. So I will let the county executive finish up.
Thank you, Dr. Bogan, and thanks for the continued report and the continued diligence of you and your department. Compiling the data, getting the calls out, getting, as you mentioned, 1,000 people a day at Castle Shannon, 1,000 shots a day at Monroeville. And again, this is just about 10% of what's going on as far as shots go in Allegheny County with the pharmacies, the hospitals, and some of the mass vaccination portions that have happened that you've seen throughout the media. We've seen, I want to say, 2 surges since this pandemic began a year ago, and both occurred when we kind of were doing very well and got a little complacent and thought, things were going well and we can relax a little bit. One was during the Memorial Day time frame, late May, early June of last year, when people started to have picnics, got together, these gatherings, sometimes weddings, graduations, etc., that occurred. And we saw a spike in our numbers in June and into July. And that precipitated, number one, a lot of hospitalizations and a lot of fatalities and concern, and some shutdowns that then had to occur. And then there was another one in late October around Halloween, and then through Thanksgiving, and we saw some very, very bad outcomes in December and January as a result. So St. Patrick's Day is one of those days, and certainly Saturday, the Saturday before, which has been the traditional parade and some of the events that have gone on. The parade obviously is canceled this year. We will have the parade again next year. I'm very confident of that. But as Dr. Bogan said, if you are going to get together, very small groups, keep it just with family and a few small friends and a small group of friends. And if you could do it outside, if the weather allows, that would be better. Spread out, wear the masks, all the kind of things. We're very, very close. And I think this year for Memorial Day, hopefully we'll be able to do a lot more things than we did as we head into the May, June, and summer months, as more and more people get vaccinated and we get, kind of on the other side of this thing in a good way. So let's not get complacent as we get near the end. Let's continue to follow the advice of our medical experts from the CDC, NIH, all the way down to our local health department and local experts. And let's stay safe this weekend and enjoy. See you next week. God bless.
Our next regularly scheduled briefing is St. Patrick's Day, Wednesday, March 17th at 4 p.m. Thank you for joining us.